Cadou. In this live, I'm going to talk about cystic fibrosis, guys. Okay, this is highly testable topic, so you must know for your Nclex exam. Um, Cystic fibrosis. So, let's start first with a definition. But before I start with my education, guys, presentation, let me give you a heads up. You know, when you are like study, prepare for your Nclex. Let's say you are doing any disease. First of all, if you're having difficulty to understand the disease, so the best thing for you, just go back to anatomy. Review the anatomy of these organs. Example, let's say you are doing CHF, okay? Chronic heart failure. But the CHF you are doing, you don't really have an idea about how even your heart, circulate blood, right? So what you're gonna do, you have to go back to the heart anatomy, how blood circulate, stuff like that. Then you will able to understand even the actual questions about CHF left side or CHF right side. Do you understand? Always go back to your anatomy, guys, okay? So let's go. Let's go, guys. Let's go. Okay. So cystic fibrosis. Cystic fibrosis is a genetic autosomal recessive disorder that affects the exocrine glands. Okay. So this disease affects exocrine glands, which is cause thick, sticky mucus to block the lungs, our lungs, pancreas, intestine, and reproductive tract. Okay, this is what happened on cystic fibrosis, guys. Okay, so this is a full definition for it. Okay, it's a genetic autosomal recessive disorder that affect the exocrine gland. Anytime you heard about cystic fibrosis, that's mean that disease affect first of all is a exocrine glands issue and is which is causing thick sticky mucus to block the lungs, pancreas, intestine, and reproductive tract. Okay, so now what is the pathophysiology behind that, guys? Okay, what is the pathophysiology behind that? This is where you need to really understand, guys, the pathophysiology. We have a defect in CFTR gene, which is abnormal chloride and sodium transport across cells result in thick mucus in lungs. And what happens in the lungs, so the airway, obstruction, infection, block pancreas ducts, okay, our ducts pancreas, which is cause poor digestion and malabsorption. Sweat glands, excrete excess salts, okay, salty skin. If you test that person's skins, you will be very salty, guys. Okay, if you just test the skin of that person, it will be very very salty because of the excess salt, guys. Okay, so what about the key affected system? What about the system, guys, that be affected about this disease? Okay, so let's right now talk about respiratory. Okay, thick mucus, chronic cough, wheezing, frequent infections, especially pseudomonas and staphylococcus. GI. So all cystic fibrosis affect GI, gastrointestinal, and pancreas. It block enzyme, poor fat, protein digestion, okay, fatty stools, malnutrition, guys. What about reproductive system? Infertility, males, thick cervical mucus, females. Sweat glands, excessive sodium and chloride loss, salty skin, risk of dehydration. So your client is at risk for dehydration. That's why you need to encourage your patient to increase more water, at least 1 or 2 liters a day. Nclex assessment finding. Okay, this is what you need to put in your mind, guys. This is where Nclex can ask you some questions. Category: respiratory, chronic, cough, dyspnea, wheezing, recurrent lungs infections. What about GI? Foul smelling, bulky stools, poor weight gain despite good appetite. Skin, what about the skin? Salty, tasting skin. Grow, failure to thrive in infants. Labs values, guys: decrease oxygen, increase CO2, sodium chloride, loss in sweat. What about the diagnostic test so doctor can order for someone who has been diagnosed cystic fibrosis, guys? Sweat chloride test, okay? And if it's greater, okay, if it's greater 60 MEQ, that means it's positive for cystic fibrosis. Okay, cystic fibrosis. So right now, guys, so let's continue, guys. Let's continue with our live. Okay, let's continue, guys. Let's continue, guys. If you join this live, just share with your friends, guys. Okay, just share with your friends. Okay, so remember that if the sweat, when they do the diagnosis, if the sweat chloride is greater 60 MEQ slash L by L, okay, then it's positive. That means the person has cystic fibrosis. So what about with Nclex nursing priority you need to know for cystic fibrosis, guys? So you need to know, okay, what are the nursing priorities? Airway clearance, always number 1 priority. Chest physiotherapy, postural drainage, 2 to 4 times daily. Nebulize bronchodilator before CPT, okay? Before chest physiotherapy. Remember that. Your patient will able to use nebulizer before, okay, before the chest physiotherapy. Always use the nebulizer first, and you can do the chest physiotherapy for your patient, okay? And also you need to encourage your patient, like, coughing, deep breathing, hydration. Remember that your patient at risk for dehydration due to excess of remember that in the beginning when I was explaining about very salty the skin, stuff like that. So you need to encourage your patient, not to force your patient. You need to encourage your patient to increase intake more fluid, right? Prevent infection. Use antibiotic as prescribed. Sometimes can be long term, guys, okay? Teach hand hygiene, very important, and avoid sick contact person, okay? Nutrition management. Those are, I'm reading right now, guys, those are nursing priorities for Nclex. You need to know them. Nutrition management, high calorie, high protein, high fat diet. This is in Nclex questions. I had this question. High calorie, high protein, and high fat diet. pancreatic enzyme replacement, okay? Always with meals, snack. Always with meals, snack, guys, okay? Fat-soluble vitamin A, D, E, and K. Salt supplements during hot weather exercise, okay? Especially, when you go, like, when you go to the gym, you have to put a lot calories and you sweat a lot. So someone with cystic fibrosis will be at risk to lose more salt, okay? So that's why during exercise you need to tell client take salt supplement during hot weather and during exercise, okay? So psychosocial support. So how you gonna support your patients, guy? How you gonna support your patient? Chronic disease. Support family, coping, grow, and schools needs. Okay? What about medications right now for your cystic fibrosis? For mucus, to make the mucus, like, thin, okay? Client will be on this medication, Donase Alpha, okay? Nclex tape, nebulizer daily before chest physiotherapy. Always open bronchi first, and after that you can do the chest physiotherapy for your cystic fibrosis client, guys. Bronchodilator, albuterol, opens airway before CPT, chest physiotherapy. Antibiotic, thrombolysin, used for chronic lung infections. What about pancreatic enzyme? Okay, take with food, okay? Take with food and with snack. If you notice your client will get any snack, and then just give to your clients, okay? That's pills, okay? I always give with food. The pancreatic enzyme food, so I always give with food, or if your patient's taking any snack. Vitamin supplement, okay? A, D, E, K. So you need to know them for your exam, okay? And then Nclex tape, they are fat soluble, replace and losses. Complications about someone who has cystic fibrosis. What are the complications? Respiratory failure, most common cause of death, okay? Remember that for your Nclex exam. Pulmonary right side heart failure. Right side heart failure. Right side heart failure. Remember that. What about diabetes mellitus? Okay? This is related cystic fibrosis. Okay? Your patient at risk for diabetes mellitus as well, guys. Malnutrition, poor growth. Okay, so I have some mnemonic for you guys in order you can remember. For CF, cystic, and F stand for fibrosis. CF, coughing, okay, and food. C, cough, chest, physiotherapy. What about F? Fatty, stools, food enzyme, fat-soluble vitamins. Thick mucus, remember that. For the thick mucus, remember that. T, thick sputum. H, high sodium in sweat. Infections, chronic. And for C, cough and chest physiotherapy. And keep calories high, guys. Okay? Simple and complex questions. Which diet is most appropriate for a child with cystic fibrosis? So you need to know that. So the answer will be high calorie, high protein, high fat diet with pancreatic enzyme and vitamins. So what is the rationale behind that? Compensate for malabsorption and high energy use. Number 2 questions, okay? Remember that a client with cystic fibrosis need high calorie, high protein, high fat diet with pancreatic enzyme and vitamins, guys, okay? And questions number 2. The nurse prepares to administer pancreatic enzyme to a child with cystic fibrosis. When should the nurse give them? Okay? With meals and snacks. Remember that rational help digest fat and proteins during digestion. Which tests confirm the diagnosis of cystic fibrosis? Answer. Sweat chloride test greater 60 MEq/liter. Okay? If the test results came back greater 60 MEq, then your client has cystic fibrosis. Which medication is used to thin pulmonary secretions in cystic fibrosis? Okay? Remember that? So the medication is Dornase alpha. So the nurse notes increased cough and sputum in a cystic fibrosis patient. What is the priority? So the priority for you as a nurse will be obtain a sputum culture and start prescribe antibiotic. Okay? So thank you for being listening to my live video, guys, so you can share with your friends. So that was about cystic fibrosis. I just went directly to the key points, what you really need to know, instead of to study a lot of stuff. If you're having difficulty to study, I can coach you, I can help you. You can book right now online at Careforallcadou.com. However, my phone number is 941-288-0745. Okay? Bye-bye, guys. Take care. Have a wonderful day, guys. Have a wonderful day. Okay?